If you're thinking of having a facelift, or if you're just interested in facelift surgery, then here are the answers to many of the questions that people ask. So first of all, some general questions about facelift surgery. People often ask me, if I have a facelift, will I look like I've had surgery? And it's a very common concern. Many of the people we see on TV or in the media look a little bit surgical, and that's a genuine concern for people. I understand that. The good news is, for the vast majority of facelift patients, it's their first operation, and for your first facelift, everybody looks natural. What we're trying to do is return you to the face that you had maybe 7, 8, 9, 10, 15 years ago, and facelift is very good at that. Now, there are some caveats, there are some restrictions as to what we can and can't do, but for the vast majority of patients, a facelift is designed to make you look fresher, less tired, more relaxed, but a very similar version of the you from 10 years ago. This is not designed to make you look like an overly stretched, shiny, tight Hollywood star. People ask, will I look surgical? Will I look pulled? Will I look tight? And again, this is a useful, important question to ask. In the early phases, the answer is yes, you will. The difficulty is that surgery on the face is very difficult to hide. It is obvious, especially when there's bruising, swelling, and the scars are brand new. And this is just something that you need to understand and accept. These signs of surgery will fade. Now, the difficulty is it's not the same time for everybody. Some people take longer, some people take shorter. And so all I can do is give you the best guess based on your skin type and based on your recovery and your previous surgical history. But you need to build in a little bit of reserve time in your timetable if this is an operation you're going to consider. People ask me, is there going to be bruising and how long will that last? The simple answer is yes, there will be bruising. It's your face, and faces are very forgiving when it comes to healing from surgery. The cost to that forgiveness is that the face has got a great blood supply. A great blood supply means good healing, but it means a lot of bruising and a lot of swelling. For most people, they will be very bruised for the first week to 2 weeks. The men tend to bruise longer and the ladies tend to bruise more, but the bruising fades due to their thin skin. I tell everybody, you're going to look like you've been in a really bad fight and that you lost. And that's almost certain for the first 2 weeks, and for many people, it's into the 3rd week. If you've got stuff to be getting on with, if you've got a life or work or children to take to school, and you think you'll be able to do that because the bruising will be disappeared after a week or so, that simply isn't the case. Many of my colleagues on the internet seem to make a career out of saying that a facelift, you'll be back at work in 5 days, or you'll be back at a business meeting in a week. This is simply not the case. A proper facelift, where we take the face apart and put it back together again in all of the areas using all the techniques that we have available, is a significant operation. And the chances of you looking normal within 2 weeks are, in my experience, almost none. So you need to make a plan for this if this is something that you're considering going ahead with. The next question, very reasonable, is will the scars be noticeable? Now, we have to make scars in order to do surgery. A facelift operation has evolved over many years, and the scars are very neat and very well hidden, but there are a couple of cautious caveats that we associate with that. Some people, their biology doesn't make great scars. Now, this is rare, and it's something we'll discuss in your history, but if you make difficult, thick, juicy, stretched scars, then this is something that might happen after a facelift. Even though the scars are well hidden in the natural creases of the face and under the chin, if your scars are problematic, then they will be noticeable for longer. The scars for men are in a slightly different place. They tend to sit in front of the ear, where for the ladies, wherever possible, they go inside the ear. This means for the guys, the scars are a little more noticeable, especially in the early period. But of course, the guys can grow a beard, which makes their scars hide away in plain sight. Oftentimes when you see a Hollywood actor who's wearing a beard for the first time, typically in their 40s or 50s, you can be pretty sure they've had a facelift, and that's the reason why. For the vast majority of patients, the scars start to fade between 2 and 4 weeks. And again, the ladies can use cover-up makeup, the fellas can grow a beard. But if somebody stands behind you, your hairdresser, for example, or a friend in a queue, or somebody standing in a lift, and they look behind your ears, then they will probably notice. And so if you're hoping for an invisible, scarless operation to make you look 10 years younger, I'm sorry to tell you that there isn't one. And anybody that tells you there is probably lying or trying to sell you something. So it's important to accept that there will be scars, there will be swelling, there will be signs of surgery, and you need to plan your week or your month accordingly to give yourself time to recover. The next category I'd like to talk about is complications around facelift surgery. People fall into two camps. Camp number one is, it'll never happen to me. And that's one approach that I don't really approve of because sadly complications happen to everybody. They're nowhere near as common as you might think, but they do happen. And if they do happen to you, then it's something that we'll have to work through together. The other camp is, complications are bound to happen to me. These patients tend to be a little pessimistic, which in my experience is probably the way to be. We always say, hope for the best, expect the worst, and ideally we'll get something in the middle. But I think in this video, it's a worthwhile thing to do, to discuss complications, because if you know about them ahead of time and you know that there's ways to manage them, then it's something that we can work on and it's something that we can help you move forward through. The most profound complication that we see and that people know about are problems with the nerve. The facial nerve is the one that we're concerned with. It's the nerve that provides power to the muscular areas of the face, namely the eyebrow movement, the symmetrical smile, and also supporting the corner of the mouth, which can droop if that branch of the nerve is injured. And we do see nerve problems. I specifically call them problems, not nerve injuries, because I can say with hand on heart, after having done many hundreds of these operations, I've never seen a permanent nerve injury, but I've seen many temporary ones. In my practice, we see these nerve problems around 2 to 3% of the time. So one case in 30 to one case in 50. If that's you, you can think like your world has ended. But as I say, I've seen these problems many times, and in every case in my experience so far, it's a matter of wait and see. Now, the nerves that are typically injured are the ones that make a symmetrical smile or the one that raises the eyebrow. During the operation, either of these nerves can be bruised, not injured, but caught up in swelling or caught up in scar tissue. That manifests itself as a weakness. Now, usually that weakness is on one side, not both, so it presents with a clear asymmetry. Either your eyebrow on one side won't move effectively or sometimes won't move at all, or your smile on one side will either be a little shorter all the way up to one side of your mouth won't move at all. Now, this looks very much like a condition called Bell's palsy, which is something you may have heard of. If you have ever had or seen a Bell's palsy, you'll know exactly how noticeable that is, but it recovers very similar to Bell's palsy in the large majority of cases. For some patients, it's 2 to 4 weeks. For most, it's 8 to 10 weeks. And for a very small group of patients, it can be longer than that, up to 6 months. And so unfortunately, this is something that you have to accept. If you go and visit any surgeon asking about a facelift, then they will discuss with you nerve problems. Now, nerve problems are much better than nerve injuries, which may never recover and can leave you with a permanent disfigurement, but it's something that we will discuss in detail. All of my videos talk about it, and the consent form mentions it quite specifically. Having said that, as we mentioned, the vast majority of nerve problems heal completely in a relatively short period of time, and we have a pre-packed excuse that will allow you to explain them away. Most patients don't want their friends and family to know that they've had a facelift operation, but nerve problems are definitely something that you should consider, and definitely something that's worth you reading up about before you consider moving forward with a facelift. The next problem we see, but not as common as you might think, is hematoma. As I mentioned earlier in the video, faces have got a really rich blood supply, which is great for healing, but also it means they bleed. A hematoma can be a simple black eye, nothing we need to do about that, all the way up to a tennis ball sized collection of blood in one side of the face or neck. Hematomas, very similar to a black eye, will settle on their own. The blood will be reabsorbed. You'll have staining and bruising, which will last longer, maybe 2 to 3 weeks rather than 7 to 10 days. But in the vast majority of cases, they resolve spontaneously. Using a number of intrasurgical techniques, we manage the risk of hematoma very carefully because it's something we could both do without. But if you get a small to medium-sized one, my preference is to let nature look after them. It will slow your healing down on that side by a week or 2, but everybody ends up in the same place. It's something that is rare, in my experience, probably 1 case in 50. If you come for a clinic appointment, I'm happy to share with you photos of hematomas and their long-term outcome to reassure you. But a hematoma is a thing, it's part of the facelift experience, and it's definitely something you need to know about. Significant hematomas, the size of a tennis ball or larger, are very rare, thankfully. In my experience, less than 1 in 250 cases. But if you get one of these, it's typically in the first 12 to 24 hours after an operation. This is why we keep you in hospital immediately after a facelift, and it's something that we can manage while you're still an inpatient. But occasionally it requires a return to theatre to suck that blood blood out. More traumatic in your mind than actually as an experience. But again, these are facelift essentials that it's important that we discuss. So be reassured, even if you look very bruised and very swollen, then it will settle. Hematomas tend to be more common in men than ladies, but never say never. The ladies experience them as well. What happens if we have a problem with our facelift result in the medium to long term? Well, the kind of problems we see something called pixie ear deformity. That's where the ear and the neck are very tightly stitched together and the ear becomes a little pulled. We try and avoid this with a number of surgical techniques, but it does still happen. If you get it, then it's a simple local anesthetic revision where we tuck the earlobe back in and we retighten the neck in an environment very similar to a dental practice. It's a local anesthetic operation with dissolving stitches, takes about 30 minutes, but again, we see it not uncommonly. We sometimes see a pleat at the temple. When we do the dissection for a facelift, it has to stop somewhere, and typically it stops down towards the Adam's apple from a neck point of view and in a direct line between the ear and the lateral corner of the eye. This is where the dissection stops, but unfortunately the tissue above this area has not had surgery and so doesn't swell and bruise in response to surgery. This can leave a demarcation, a clear line between where the face has had an operation and where the face hasn't, and actually this forms the reason for our revision. We simply undermine the old scar, not creating any new scars, and we lift the skin above this pleat, and this tends to improve it, and in probably 60 to 70% of cases this will fix the problem. Again, it's a simple local anesthetic procedure. Very occasionally we need to have another go at this problem because patients with thin skin, often men, and actually for a deep plane technique in the mid-face this is more of a problem, but again, pleating is a problem that we can fix under local anesthetic. It's something we've seen many times. Interestingly, it's a real giveaway that you've had a facelift, and so patients often complain quite strongly about this problem, especially the men who can't cover it with long hair. So be rest assured that we've seen this many times before, but if you ever look at a Hollywood face, you might see signs of pleating. This will in the future let you know that these patients have had a facelift. People ask about scar problems. What happens if the scars don't heal nicely? The answer to that is the scars almost always heal nicely, partly due to technique and experience, partly down to the patient's individual biology, but also faces are very forgiving when we operate on them. The scars tend to do very well. Now, different folks heal at different speeds. Typically the older patient, classically the 65 to 70-year-old lady with very fine skin, tend to make beautiful scars that heal really quickly. The thicker Mediterranean skin patients tend to make thicker scars. These are the scars that tend to stretch, look a little lumpy, look a little more obvious, but again, it's only a matter of degrees and it's only a matter of time. Pretty much everybody ends up with good quality scars in the end. It's impossible to know which group of patients you're going to be. Some patients with thick, oily skin heal brilliantly, and some people with very relatively fine skin take some time to heal. If you're one of those other patients, it's all part of what we call the normal distribution. That means it's all normal, but when I say to patients, your recovery will take 3 to 4 weeks, then what I mean is 80 to 90% of patients will take 3 to 4 weeks. You might be one of the 10% that takes longer. And so it's important to be aware that this might be you. Don't just assume that it isn't going to be you, because it might be. Patients ask me, when will I look normal after a facelift? Now, normal's a relative term. For most people, normal is when can I go to Tesco's and do the shopping? And again, 80 to 90% of patients will be able to stand in the Tesco's queue within 3 to 4 weeks. If you're going to dinner with your twin sister or your brother-in-law who you haven't seen, or you don't want your parents or your children to know you've had facelift surgery, then this is a much more difficult standard by which to judge your facelift result. Now, for those patients, if you have a business meeting where people are going to sit closely to you, or you want to go out with extremely close friends and you don't want them to know you've had surgery, then for many people this can be 6 or 8 or 10 or even 12 weeks. This result takes longer to achieve than simply meeting up with strangers and them not realizing you've had surgery. So again, the easiest way to manage this situation is to let people know you're having facial surgery. You don't have to be completely specific, but if you say, I'm having an operation on my face, then it makes a lot of those difficult questions and those difficult social scenarios go away. But when will I look normal? It's different between people, and it's also different between scenarios. So bear in mind what you have in the immediate future after your facelift, because that will dictate when your normal might be. People ask about infections, and thankfully infections after facelift surgery are rare and they're usually undramatic. We do see them not uncommonly, probably one case in 20 where we get a little bit of redness or a little bit of discharge, typically around the earlobe, but almost every infection I've ever seen following a facelift responds well to simple oral antibiotics. Interestingly, we give everyone antibiotics when they leave hospital for 7 days, and in my experience, infections tend to occur between day 7 and day 10. This is whether we gave antibiotics or not, but as I say, tablet antibiotics, usually a second course, is the treatment of choice for the vast majority of these problems. Very rarely, maybe one case in 100, we have a little bit of fluid that we need to drain with a needle. Thankfully, the skin is numb, so that's not as unpleasant experience as it sounds, but infections, in my experience, are almost never a significant problem after facelift surgery, just something we need to look out for. The next group of questions I'd like to visit are lifestyle questions, namely, when can I go back to my normal life after a facelift? Life after facelift is something that people need to plan before they go ahead with surgery. They need to consider their holidays, they need to consider taking the children to school, they need to consider their work environment or their social interactions. Many people ask me, when can I go back to the gym? Now, it depends what you do. If you do simple light exercise like jogging or light weights while sitting up, then for many people that's 2 weeks. If you need to walk the dog, or if you want to go for a stroll just to clear your head, then for many people that's the first week. If you want to go back to Pilates or hanging upside down on rubber bands and doing stretching exercises or doing very heavy weights, then these are typically 4 weeks delayed by a facelift operation. Swimming is another one. If you have a facelift, then most patients wouldn't want to go swimming for 3 to 4 weeks. If you want to do something very rigorous, something very physical, people do triathlons and high rocks and all of these intensive exercises, then after a facelift, I would strongly recommend you take 4 to 6 weeks off these types of activities. In summary, it depends on you and it depends on the activities you want to get back to, but there will be a delay. When can I leave the house? As soon as you feel comfortable. It's usually about the way you look rather than the way you feel. Most people feel quite good after a facelift. Having said that, there is some emotional exhaustion. People often sleep for 2 or 3 days, but after that, then you can go about your business. You can function, you can tidy the house, you can make food, you can walk the dog. But if you want to go to a public space where people are looking at you, then as we've already discussed, this is going to be longer. When can I shower? I strongly encourage patients to shower immediately after a facelift. I'd rather the wounds were clean and wet than dirty and dry. It also makes you feel better, you feel more human, you feel more able to cope with the recovery process. So showering, we encourage the morning after your operation. So please wash your hair, wash the wounds gently. Don't be touching your face or touching the scars, but you can shower straight away. You can comb your hair straight away. If you dye your hair, then you want the incisions to be healed. So that's typically between 2 and 4 weeks, depending on how you heal. How about work? Many people work from home these days, and I tell people probably take the first week off, but from week 2 onwards, you can work at a desk. You probably won't do a full day's work. You might be able to do 2 to 4 hours. It's exhausting having a facelift. Emotionally, physically, and biologically, it's very tiring. So my advice to most people is book something into the diary, keep yourself busy, but don't book a full day's work probably for 2 weeks after. Different strokes for different folks. Some people manage to get back to work the first week. Some people feel absolutely exhausted for the first 2 to 3 weeks. But for most people, they could function in an office or business capacity within a couple of weeks, I would suspect. In terms of going to an office, it's about your self-confidence. If you go to an office where people are very open and you tell them you've had facial surgery, then again, maybe 2 to 3 weeks. If you want no one to know and you sit very closely with friends and colleagues at their desks or in a work environment, then maybe 4 weeks, maybe 6 weeks. It's a little bit difficult to tell, and we'll have to tailor your advice specific to you. Can I hide the signs of facelift surgery? Well, you can. The ladies can put makeup on. Actually, of course, the fellas can put makeup on. They tend not to. The key is when the bruising becomes yellow or pale, you can cover it with foundation and powder. When the bruising is black and blue, you can't. If you bruise lightly and it fades quickly, then you can put makeup on within a week. I've had patients go out and about a week after their operation with a face of makeup and not be concerned. For the majority of patients, I would say 2 to 3 weeks. And for the fellas, if you grow a beard, then probably 2 to 3 weeks the same. But again, expect the worst, hope for the best, and you'll probably be somewhere in the middle. The last category I'm going to talk about is what advantages does a facelift offer? Is a facelift worth it? Well, they're personal, but in most cases, a facelift will make you look fresher, less tired, more youthful. To put a number on it, we simply describe a facelift as taking 10 years of age off you. Now, there's a few caveats with that. If you're 45 seeking your first facelift, then it might make you look 5 or 6 or 7 years younger, subjectively speaking. If you're 70 and it's your first facelift, then we might make you look 12 or 15 years younger. So it's not the same for everybody. People ask me, how long will my facelift results last? And this is a really common question. The key is, if we make you look 5 or 7 or 10 years younger, from a personal opinion, of course, then you will always, for the rest of your life, look that many years younger. So if we make a 50-year-old look 43, they will always look 7 years younger than their actual age. If we make a 65-year-old look 52, then they will always look 13 years younger than their actual age. The difficulty is that a facelift doesn't freeze you in time. It doesn't stop the aging process. So once it's healed and it's settled, you will continue to age. So a facelift at 60 doesn't mean when you get to 70 you might be dissatisfied by the fact that you look older again. Of course you will, and this is why people often come back for a second facelift or a third facelift or very rarely a fourth facelift. So don't think that one facelift will be the only operation you ever need to remain youthful for the rest of your life. It doesn't quite work like that. Moreover, there are other techniques that we might consider. Eyelid surgery, for example, brow surgery, for example, that are additive to the effect but separate from a facelift. But for the vast majority of people, the value they extract from their facelift, be it their first facelift or otherwise, is lifelong. So this is a good thing to know for many of my patients. Probably the last question I'd like to discuss is, will I look like a Hollywood star? And you can insert any Hollywood star you like. Some of them look fabulous. Or will I look surgical and fake? And here's some examples of those Hollywood stars. The key to that question is taking the right advice and making good decisions. Oftentimes we see patients who look fake and surgical. They've opted for too much treatment in short succession, too many operations, too many additional treatments like filler and Botox and energy delivery and microneedling and treatment upon treatment upon treatment. And the difficulty with those patients, be them famous or otherwise, is that the tissues become stiff and injured and shiny and their faces don't move like they should and their expression isn't normal. And this is a real giveaway. As humans, we're very highly tuned to recognize subtle detail in facial expression. It's why we evolved to have little facial hair compared to other apes and primates, is because the expression on people's faces is very important to us. It's how we communicate non-verbally. And if your face has had multiple surgeries and your eyebrows don't move very effectively and your smile isn't very long or very convincing, then this is a giveaway of too much surgery. Rest assured that the right advice given to the right patient will keep you far away from these types of results. At the end of the day, you are your surgeon's shop window. He doesn't want you looking fake and artificial any more than I want my patients looking fake and artificial. We will do our best to give you advice, allowing you to look the best version of you, but also the most natural version of you. Next question is, what age is the best age to have a facelift? Well, the answer is when you've got the motivation, when you don't like the thing you see in the mirror enough, but also when you've got the time to accept the recovery and the surgery and the process and the swelling and the rare but possible complications. Some people at 45, they see a little bit of tiredness to their face, a little bit of sagging of the cheeks and mild jowls, and that might be the time for them. Some patients wait till they're 65 and they're retired and the children have gone away and they've got the time to hide away while they recover. They've got the means to afford an operation like this, and for them that's the time. It's important to get good advice from your surgeon. For a small group of patients who are young, I say there's not enough value in it. There's not enough positive change to be derived from such a big operation, accepting that there will be scars and recovery and process. For other patients, very rarely, their face is so heavy and so sagging that it's not an ideal operation for them. This is specifically a problem when the skin quality is compromised, We see a lot of patients who were heavy sun worshippers when they were younger. This is a thing in my generation and one generation above, and very, very damaged skin is hard to retrieve. So the answer to what age is best is, well, it's very personal to you. If you can find the time, then I'll help you plan that time, plan your recovery, but it's something that we'll have to decide together. Can I combine a facelift with other procedures? Well, yes, you can. Facelift with eyelid surgery is very common. Facelift with one other body surgery is something you can do. We try and keep all cosmetic surgery operations to less than 4 hours. And so if your planned operation is longer than that, then we would probably suggest you divide it into 2. It's also about recovery, but again, this is something we can discuss at your clinic appointment. The last question I'd like to discuss is, who's the best surgeon to choose? Well, in my estimation, the best surgeon for you is someone who's local. It's important to be able to go back, ask them questions, to have access to your surgeon if you have any concerns. Surgical tourism is a thing now and people can save a lot of money by traveling, but if you have a problem, then the distance will become further than you would prefer. The next important question for your surgeon is this a common operation for you? Now, in any surgical procedure, the more you do, the better you are, the more you can tailor the operation to an individual patient. Someone who's done hundreds of facelifts will be better at someone who's done tens, and someone who's done thousands will be better than someone who's done 100. Having said that, it's not easy to find someone who's done thousands of facelifts, but you'll get a feel for the experience of your surgeon, but ask them questions relevant to their experience. You'll get a better fit if they are an experienced facelift surgeon who's seen your specific type of face before. Ask them to show pictures of faces like yours, patients of a similar age, patients with a similar skin type, and that will give you confidence that they've operated on people like you before. Hopefully that's answered some of the questions you might have. If I've missed any out or there's questions that you would like me to elaborate on further, then by all means leave a question in the comment and I can reply to you personally. I try and do that to every question or comment I get. Otherwise, I look forward to seeing you on the next video.